Hey Moses, we have another question here. Is it true that gamers get a lot of carpal tunnel syndrome?
I wouldn't say I see a lot, but I do see a few. And sometimes even from my friends, actually.
Luckily, the younger population, it doesn't last long. They have this one episode and they get better after that.
Hi, good morning. I'm Dr Moses Loh, and I'm from Loh & Clinic and Surgery.
I'm Sandeep Sebastin. I'm a senior consultant hand surgeon at Alexandra Hospital. We are happy to be at Ask Lokun, and I'm here to answer your questions on carpal tunnel syndrome.
Okay, so what is the first question? How do I know if I have carpal tunnel syndrome?
The symptoms are initially tingling. Over time, it changes to numbness, which is also in colloquial terms known as MAPI. Is there anything else patients complain about, Moses?
Yeah, so I think normally either one of the aunties, uncle come to my clinic and they say, 医生，这里有点麻痹，有点生生感觉. And sometimes they always do this flapping motion to try and relieve it. Why do people get carpal tunnel syndrome?
95% of patients, we call them as having idiopathic carpal tunnel syndrome. Idiopathic essentially means I don't know. So that means in 95% of patients, we don't have a real cause for carpal tunnel syndrome. In 5% of patients, we do have a cause. It can be either due to a tumor in the wrist, like a ganglion, or other conditions like gout, rheumatoid arthritis, and occasionally in pregnancy due to some fluid deposition, they may present with carpal tunnel syndrome. So I have this model that demonstrates the anatomy. This area in white is the carpal tunnel, and the structures that go through it are only two. There are tendons. The only other structure in the carpal tunnel is the median nerve. When there is increased pressure in the carpal tunnel, increased pressure on the nerve does not like it, and therefore it doesn't do its job properly.
So how can I tell the difference between an ache versus carpal tunnel syndrome? So for aches, most of the time it's due to something muscular, skeletal related. For example, after we go to the gym, we feel this soreness in our muscles or joints. Whereas carpal tunnel is the numbness, the tingling of the hands, and sometimes even weakness. Is it okay to leave carpal tunnel syndrome untreated?
Firstly, what we would do is to confirm that you really have carpal tunnel, because the initial diagnosis is based on clinical examination. The next is we grade the severity of carpal tunnel based on their presenting symptoms.
Basically, once you have the symptoms of carpal tunnel syndrome, you should try to have some form of treatment to try to let it recover. It doesn't have to be immediately surgical. You can take some what we call conservative management first. We start off with some oral medication. In addition, we want to prevent the wrist from being overly extended, overly flexed. So sometimes we also recommend wearing a splint to sort of keep the wrist in neutral position. Otherwise, we do recommend some activity modification.
After they've gone through at least a 3 to 6 month period of conservative treatment, if the symptoms do not get better or they become worse, then we would discuss surgical treatment options. Hey Moses, we have another question here. Is it true that gamers get a lot of carpal tunnel syndrome?
I wouldn't say I see a lot, but I do see a few. And sometimes even from my friends, actually. And I think what happens is that, sometimes they are very focused on the game, right? And because of that, they keep flex position for a long period of time. That may predispose them to developing carpal tunnel syndrome.
Luckily, the younger population, it doesn't last long. They have this one episode and they get better after that.
Any tips for preventing carpal tunnel syndrome?
Some exercising, which is part of the nerve gliding exercises, keeps the nerve in good shape, and avoiding extremes of postures for too long. I think these are the two things that I would suggest can go towards preventing carpal tunnel syndrome.
We want to prevent the nerve from being compressed. If someone can keep in mind and try not to do that, I think that's the first tip to prevent it. Thank you for tuning in to our little Q&A session today.
Please tune in for subsequent episodes of Ask Lokun. Take care and bye.
Bye.